Yeah.
Hello, my name is Kupo Brandt. Today I'm performing the 12 cranial nerve test. So the first cranial nerve is called the olfactory nerve, and that's for smell. So I'm going to ask my client to please close their eyes, and I would like you to take a deep breath in and try and identify the object that's under your nose.
Mint.
That is correct. Good job. And that test is completed. Now, the second test is the optic nerve. And for this exam, I'm going to ask the client to put one hand over their eye, and I'm going to take my hand and I'm going to put up a number 1 through 5 in the 4 quadrants. Now, please tell me what you see.
2, 2, 1, 3.
Good. Now switch eyes, please.
1, 2, 2, 2.
Good job. Now, the third one is the ocular motor. And for this exam, I'm going to ask her to please put your hand in the center of your face, and I'm going to shine a light and see if her pupils constrict. Perfect. Perfect. They both constricted. Now, another way to perform this exam is to have the client follow my finger with her eyes. So I'm going to just slowly go like this. Good. I'm seeing her eyes. Perfect. Now, the fourth one is called the trochlear. And for this exam, I'm going to ask my client to please look with your eyes down, then back up. I'm going to see. Good. Perfect. Okay. Number 5 is trigeminal. And for this one, it is like the facial sensation and her jaw. So what I would like you to do is open up your mouth, please. I'm gonna try to close your jaw. Do not let me close it. Perfect. Now I'm going to move your jaw side to side. That feels great. Now I'm gonna take this marker and I'm gonna point on places, and I would like you to tell me where you feel them, please. Perfect. Yes, close your eyes. Good. Perfect. Now, number 6 is abducens. And for this one, I would like you to please look straight and go side to side with your eyeballs. Perfect. And the 7th one is called the facial nerve, and this I'm trying to find her facial expressions. So if you could please smile and raise your eyebrows. Very, very good. That's awesome. Now, the 8th one is called the vestibular cochlear. So for this one, you are supposed to have a tuning fork, but since we do not, I will just rub my fingers and ask her if she can hear the sound. Do you hear that?
Mm-hmm.
Perfect. Number 9 is called the glossopharyngeal. This one is for taste. Now, I should have a swab and put it in the back of her throat, but since I do not have that, I would just ask her to swallow. Can you swallow, please? Do you taste that just a little bit?
Mm-hmm.
Perfect, that's perfect. Now, number 10 is the vagus nerve, and this is for speech. So if you could please stick out your tongue and say ah. Good, I hear that perfectly. Now, the 11th one is called the spinal accessory nerve, and for this one, can you please shrug and move your head side to side? Beautiful. Now, the 12th one and the final one is called the hypoglossal nerve, and can you please stick out your tongue and go from cheek to cheek, side to side. Perfect. And that is the 12 cranial nerve exam.